So good morning. Today we are going to talk about parvoviruses. So let's first talk about the Parvoviridae family. So Parvoviridae family has many viruses which commonly cause infection in pet animals like dogs and cats. Okay. Except for there are two genuses within the parvovirus which are known to be associated with human infections. So first one is erythroviruses and the second one is bocavirus. So bocavirus is recently discovered and it contains 4 serotypes which are isolated majorly from the respiratory tract specimens in patients suffering from upper respiratory tract infections, and then sometimes it can also be isolated from stools of patients which are suffering from diarrhea. So this is what you have to know about bocavirus since it is recently discovered. The main one is erythrovirus, which contains only one pathogenic serotype known as parvovirus B19. Okay. So what are the general properties of parvoviruses? So parvovirus B19 is the smallest pathogenic virus, 18 to 26 nanometer in size. Now why it is called as B19? Because it was first discovered in the 19th well of microtiter plate which was being tested for hepatitis B surface antigen. Okay, so from hepatitis B the B comes, and then from because it was found in the 19th well of the microtiter plate, that's why 19. So parvovirus B19. So first it is the smallest pathogenic virus which we see. Second, it is non-enveloped. Then it contains a icosahedral capsid. Okay. Then like all the DNA viruses, the replication here happens inside the nucleus. That's why nuclear replication. And then it has single-stranded DNA genome. So it is a very differentiating factor between all the all the DNA viruses are has double-stranded DNA. This is the only DNA virus which contains a single-strand DNA genome, which is of 5.5 kilobase pairs. Okay, so what these genomes encodes is one non-structural protein which is NS1, maybe some enzyme, and two structural proteins VP1 and VP2, both are your capsid protein, and this is your some enzyme. Okay. Now, how will you cultivate a parvovirus? Now, cultivation of parvovirus is very difficult. It does not grows in routine cell lines. Okay, so you only require primary erythroid cell lines for growing them. Okay, why? Because receptors of parvoviruses are P blood group antigen or globocytes, which are only present in large numbers in erythroid precursor cells. Okay, so this is the reason why parvovirus has affinity for normoblasts and pronormoblasts. Okay. So now if a person is devoid of the P blood group antigen, does not have P blood group antigen, so he is resistant to any parvovirus infections. Okay. Now all the infections, all the cells which the parvovirus infects become cytotoxic. Okay. So this is because some hemolytic anemia will always be associated with a primary infection with parvovirus. So if and only if a patient has a hemolytic anemia, he is going to have a primary infection of parvovirus. If a person is healthy and he gets a parvovirus infection, his hepatitis count will go down, but the patient, since he is healthy, will repair itself. Okay, but if he already has hemolytic anemia, then he is going to develop a primary infection with parvovirus. Most probably aplastic crisis is going to occur. Okay, so apart from these erythroid precursor cells, parvovirus can also infect platelets, endothelial cells, placenta, myocardium, especially fetal myocardium, and liver. Okay, Okay, now we come to route of transmission. So the most common route of transmission of parvovirus is respiratory route. It can also be transmitted by blood or blood products like RBCs, platelets, clotting factors, and intravenous IgGs. Okay, then it can also be transmitted across the placenta. Okay, so it causes disease in the neonates also. Okay, now infection. So infection of parvovirus is very common. It is ubiquitous in nature. So by the age of 15, 50% of the population has already been infected. By old age, 90% are infected, and these infections are majority of these infections are asymptomatic. Okay, and followed by this asymptomatic infection, you are going to get lifelong immunity. Okay. Okay, now what immunity, what antibodies are formed against parvovirus? So IgM antibodies appears on the 10th to 12th days after infection. Okay, and then it disappears after a few weeks. Okay, and this is for IgM, and IgG appears around the same time, on the 14th day or second week, and they will persist lifelong after infection. Okay. Now we come to clinical manifestations. Now mostly, as I already told, mostly the infections caused by parvoviruses are asymptomatic. Okay, but when it becomes symptomatic, then primary infection is going to occur. So first we are going to talk about primary infections in childhood. So if symptomatic, then a child develops a fifth disease, which is also known as erythema infectiosum. Okay, so this disease has an incubation period of 2 to 3 weeks. So symptoms include, on the 10th day, the kid is going to develop fever with coryza, that is running nose, and malaise, and then on the 17th week, slapped cheek rash with some circumolar pallor will be seen. So the cheek is going to be all red, and circumolar around the mouth the skin is going to be pale. Okay, along with that, you are going to also see lacy reticular rashes on the limb. So lace-like rashes you are going to see on the limb. It looks like this. So as you can see, here is total redness, and then here the pallor is there. So pale circumolar pallor and the slap cheek rash, and also lacy reticular rashes you can see here. Okay. So these symptoms eventually they get spontaneous resolution of symptoms happens in around 5 to 7 days. And diagnosis, how will you diagnose? By looking for antibodies by using ELISA. So ELISA for IgM and IgG antibodies. Okay. So now what happens if mostly in children this fifth disease occurs, but sometimes children can also get primary infection like papular purpuric gloves and sock syndrome. Okay, so this is how it looks like. So in it you will get painful puritic symmetric swelling of hands and feet. Okay, so see, symmetric swelling of hands and feet can be seen, which is known as papular purpuric gloves and sock syndrome. Okay, so diagnosis again same as fifth disease by ELISA. Okay, this is so purpuric is also here. Okay, now if primary infection happens in adult, then they are going to get symmetric small joint arthropathy. Okay, so and the most common joint which is affected is wrist and hand. So it will look like this: symmetric small joint arthropathy. So this is swan neck deformity. Then both of them are symmetrical, and the deformities are also totally symmetrical. Okay, so that's why known as symmetric small joint, and the most commonly affected joints are wrists and hand. Okay, now in primary infection in people with high RBC turnovers. So high RBC turnovers are patients who have SCA like sickle cell anemia, spherocytosis, and thalassemia. So in all these patients, the hepatitis, the hemoglobin level is going to fall extremely, which will result in transient aplastic crisis. Okay, diagnosis is again the same for both of the for symmetric small joint arthropathy and for both the diagnosis will be ELISA only, and for the reduction of antibodies, and treatment in this case will be blood transfusion. Okay, so this is what it looks like. Then then we come to primary infection in immunodeficient patients. So patients suffering from HIV, transplant recipient, immunosuppressive therapy, all these patients have no immune response in them. So when there will be severe fall of hemoglobin levels, then pure red cell aplasia can be seen. Now here the diagnosis can't be done by your ELISA. Here you have to do PCR, and a treatment will be providing additional immunoglobulins. Now we come to our last slide. So this is your primary infection when it happens in pregnant women. So it happens in the first half of the pregnancy. There is 30 to 33% risk of transplantal transmission, and then 5 to 10% of this infected fetus is develops fetal hydrops, and 15 to 20% of fetal hydrops is due to parvovirus B19 infection. Okay, so thank you.